There are a number of really simple risk factors that we can look to help us gauge the risk of a particular setting. I'm just going to step through each of them one at a time. So if we look from low risk to high risk, the first of those factors is duration. So the longer people are in an environment where they're breathing shared air, then the higher the risk is going to be. The next one is the number of people. Obviously, if you have very few people in a space, that's going to be lower risk, whereas you've got a large number of people, it's going to be higher risk. You can have more likelihood of an infectious person being in the room. We talked about physical distancing, and proximity is another risk factor. So when you've got people spaced out, you are greatly reducing the risk of close range or short range transmission. And when you have people packed in very close proximity, then that close range transmission risk is going to be much higher. Ventilation, we've talked about quite a lot. If you have excellent ventilation, then the risk of long range COVID transmission is going to be much lower. And if you have really poor ventilation, then that risk is much higher. We've talked about HEPA filters as another way of removing virus particles from the air. If you have appropriately spec'd HEPA filters that are turned on and running, then the risk is going to be much lower than if you have no HEPA filters. Aerosol generating activity is another risk factor that's actually relatively poorly understood. As we've talked about before, breathing generates aerosols, but there are some other factors that we'll talk about in a moment that actually produce much larger volumes of aerosols. And so aerosol generating activity is another risk factor we're going to spend some time on. And lastly, mask wearing. If you have everyone in a space wearing a mask, then that's obviously much lower risk than if you have no one in a space wearing a mask. I mentioned aerosol generation as a risk factor, and there's actually been quite a lot of research done to study aerosol production from different types of activity. If we look at breathing, first of all, we know that people generate aerosols by breathing, and it's around about 500 particles per minute. When people are talking, they're generating quite a lot more aerosols. It's about 2,000 per minute. Singing, interestingly, generates around 6,000 aerosol particles per minute. Playing a wind instrument, and this is from a study that I've linked to below, generates as many as 12,000 aerosol particles per minute. And vigorous exercise, a massive amount of aerosol production at 76,000 particles per minute. So what is important to take away from this is that you can absolutely be infected by somebody who's in a room simply breathing, because that generates aerosols. But if you're in a room with people who are talking, singing, playing wind instruments, and particularly doing vigorous exercise, the risk of COVID transmission can increase massively. So let's look at some of the highest risk activities based on these 7 risk factors that we've just talked about. The high risk activities that are common in schools are classrooms with poor ventilation, large indoor events, things like assemblies and concerts, bus trips, especially if they're on buses that have no openable windows and the air conditioning is on recirculated air, shared accommodation at camps, and any of these indoor activities that involve singing, physical activity like sports and gym activities, and playing of wind instruments. Let's look first at classrooms that have poor ventilation. Students spend a large proportion of their time at school in classrooms, and if those classrooms aren't well ventilated, then they represent a high risk environment for COVID transmission. That's because if we go back to our 7 risk factors, classrooms have a large number of people. They typically have students in close proximity. They often have talking, they have a long duration, and in most schools they typically have very few people, if any, wearing masks. So in classrooms that are poorly ventilated, you have a risk of both short range and long range COVID transmission. The second high risk activity I'd like to talk about is large indoor events, things like assemblies, concerts, discos, graduations. These typically have the risk factors of a long duration, close proximity. They often have singing or at least talking, and obviously they have a higher risk if they're not well ventilated. And again, these types of indoor events have a risk of both short range and long range transmission. And the last one I want to talk about is bus trips. Buses are notorious for being poorly ventilated. They typically have long duration, close proximity, talking, and if they don't have openable windows, which is quite common in Australia, then they may very likely have extremely bad ventilation. Just to illustrate that point, I'm going to show you some posts from a teacher in Australia who posted some CO2 levels from a school camp. So this is a photo of a CO2 monitor on the school bus. This is from May this year. Heading to camp, 51 kids, 5 staff, 1 bus driver, 2 people masked. The teacher has asked the bus driver to allow fresh air intake, and there was still CO2 level of over 2,000 parts per million. And then on the return trip, the CO2 levels got in excess of 8,000 parts per million. As we were talking about in a previous module, this not only represents an extremely high COVID infection risk, but actually is well into cognitive impairment territory. Now, at 8,000 parts per million of CO2, that means 20% of the air that's being breathed in, that's 1 in 5 breaths, has already been in someone else's lungs. Sadly, the week following this camp, there were 5 kids who were confirmed infected with COVID as a result of taking part in the camp. And then another update from a few days later, 9 kids were away. So that's 9 suspected COVID cases, which is really unfortunate from a camp that should be a safe place for kids and for staff members. The last high-risk category I wanted to talk about is shared accommodation at school camps, so things like tents and cabins. These are high risk. If we look back to our risk factors, they have long duration, they have close proximity, and typically they have very poor ventilation. Unfortunately, we're seeing anecdotally some stories of schools where parents are choosing to send kids to camp knowing that they're sick, but sending them anyway because the kids don't want to miss out. And so this is really unfortunate and can lead to large numbers of other students and staff being infected. If we look finally at low-risk activities, there are 2 obvious categories of activity that are pretty low risk. The first is anything that's outdoors where you don't have large numbers of students closely packed together. And the second one is well-ventilated classrooms with HEPAs running. So we know that a well-ventilated classroom reduces the risk of long-range transmission. HEPA filters further reduce that long-range risk. Mask wearing will reduce the short-range transmission risk, as will social distancing. But these are really the 2 categories of activities that we know for a fact are very low risk. Finally, I want to talk about high-risk activities out of school. Infections that are brought into the school environment have to come from somewhere, and unfortunately there are some types of activities that we know are much higher risk for people getting infected with COVID. Probably some of the obvious ones are busy restaurants, particularly restaurants that are indoors, have large numbers of people, and don't have a lot of good outside air being brought in for ventilation. Bars and restaurants, pubs, anything of that sort where there's a lot of people. If there's talking, that increases the risk somewhat because of the increased aerosol production. With any of these settings, you can gauge the risk to some degree by bringing in a CO2 monitor. Now, if it's under 600 or under 800, that's a pretty good sign that there is pretty good ventilation. It's not uncommon to go into a busy restaurant or a bar like this one and find that the CO2 is 1,500, 2,000, or even more than that. And that would be a sure sign that the risk of getting infected with COVID, if there was one person anywhere in that indoor space, is actually quite high. We know for a fact that public transport is often very poorly ventilated and crowded and people in close proximity, so that's a very high-risk environment. Likewise, airport terminals, anywhere else where you get large numbers of people gathering indoors. Planes are actually potentially quite high risk, particularly during boarding. So at times when they're still on the ground, the air conditioning and the filtering system is not at full capacity, and so the risk during that part of the flight is actually pretty high. We know for a fact that there have been many cruises that have had large COVID outbreaks. So cruises, because of the large numbers of people, close proximity, often indoors, in environments where people are typically not masked. Perhaps one of the highest risk ones that's possible is crowded indoor gyms. Particularly we've got people doing vigorous physical exercise. So something like this spin class with a large group of people in it, unless it's extraordinarily well ventilated, this would be an extremely high-risk environment for COVID infection. It's important to be really clear here that no one is suggesting that people shouldn't live a normal life or that they should be restricted from doing things that they want to do. What we are suggesting, though, is that because we're living through a global pandemic, it's actually really sensible to just modify some of your behaviors in order to minimize the risk to you and your family. And so that might mean simple things like, if you're going out to dinner, choose to sit outdoors instead of indoors in the restaurant, particularly if you can see that it's crowded or that it's not well ventilated. It might mean catching up with friends outdoors rather than indoors, or if you are indoors, make sure it's in an environment where you know it's well ventilated. If you are going to be in environments where you know you'll be around a lot of people and it's not likely to be well ventilated, then you may need to wear a mask, and these are places like airplanes, airport terminals, and public transport. I think one of the biggest obstacles to people avoiding high-risk situations or modifying their behavior to reduce the risk in places like we've just discussed is that there's a perception that the risk is really small and therefore it's inconsequential. In all probability, the risk of you getting infected with COVID on one occasion, whether that's sitting in an indoor restaurant, getting on an airplane, or sitting in a classroom full of students, is probably very low. But I think what people often don't appreciate is that the risks are cumulative. If you take these very small risks many times over a long period of time, they add up to being a pretty substantial risk. If you're a maths teacher, you might be familiar with this equation for calculating cumulative probability. And what it allows us to do is to calculate the probability of something occurring over a period of time. In this case, we'll talk about the probability of getting infected with COVID over, let's say, a 12-month period. And in this equation, R is the risk of infection per high-risk event. So a high-risk event might mean spending an hour in a classroom, or it might mean going to an indoor restaurant or a gym or some other place where you're around people who might potentially infect you. And N is the number of those events over a 12-month period. So let's plug in some hypothetical numbers just to illustrate the logic. If we look first at the infection risk per high-risk activity, we might say that that's something like 1 in 1,000. These numbers are indicative, but that's probably fairly close to reality most of the time. If you go into a classroom full of students, in all likelihood, nobody in that classroom has COVID on that specific occasion. And even if someone does have COVID, it's not guaranteed that you're going to get infected. If you're a teacher, the number of high-risk activities that you take part in per day might be around 4. So let's say that's teaching in 4 different classes. Then if we multiply that out to the number of days in a year, let's just look at weekdays for the sake of this exercise, that adds up to over 1,000 high-risk activities per year. Then we can use the cumulative probability equation to work out that your infection risk over a 12-month period is actually around 65%. And this matches with reality. What we've seen in Australia over the last couple of years of the pandemic is something like 60 to 70% of the population is getting infected once or more every year. Finally, back to where we started, the Swiss cheese model of layered mitigations is really important here because we know that none of these layers is perfect, but by combining them, we massively reduce the risk of COVID infection. So layered mitigations is the way to think about risk reduction in a school environment.